And a very good afternoon, everyone. Welcome to Issues and Attitudes. My name is Jeff Owens, Interim General Manager at WEIU TV and Radio. My co-host is Dan Jones.
Happy Monday, everyone.
Making a repeat appearance, but in studio for the first time, Krista Taylor from Carle.
Hello, good afternoon.
Welcome, Krista. She is a licensed clinical professional counselor.
That's correct.
You like that? So LCPC, if you want to refer to her.
LCPC.
All right? LCPC.
You can call me Krista, just to make it easy. So.
There you go. Well, Krista, thanks for coming in, first of all. And then we're going to talk a lot about the mental health side of the pandemic and COVID and all the stuff that we're going through right now. But I guess during the pandemic, the one thing that really didn't come out, it seems, until later on was the mental health aspect of it. And now it's come to the forefront with a lot of people experiencing some issues. So talk about that, and then we'll get into some details.
So, you know, when I was back here, I think it was April of last year, we really didn't know what the impact was going to be. We had sort of circumstantial information, like I was seeing more patients, other therapists I talked to, the people that we were seeing were having a little bit more intense problems. And now we actually have research. So we know that there's been a huge mental health impact across the board, especially for younger adults, 18-24, so students here at Eastern. Women, people of color especially have been impacted by a lot of things. So we have a lot more information. So we knew it was going to be an issue. We didn't know how much of an issue it was going to be.
Can you share a couple of maybe some information?
Sure. So I brought some recent, very recent information. And so one of the things that we really see in terms of young adults. So when you think about what impacts us in terms of mental health, a lot of it is sort of socialization or connectivity. So young people are much more used to being out and about and being social and being on the go and doing things. And so with a lot of remote learning, universities going to that, they may have had jobs that were not essential, and so they lost their income. And so there has really been a significant increase for younger people's with depression, anxiety, and across the board, but especially the young adults, we're seeing a lot more substance use issues. So while that was always sort of a risk category for substance abuse problems and developing those, it's really increased a lot. And now we have data that shows us that's what's going on.
Okay.
What are some of the trends that you see in kind of older adults? Because you talked a lot about younger adults. What are some of the trends that you see in older people as well?
So one of the challenges always is for the older generation, and I got parents that age and a grandmother that age. So one of the things is trying to stay connected. So while you're very familiar maybe with using technology, getting on, doing a Zoom call, having a FaceTime, doing something like that, the older generation is not necessarily as tech savvy, which isn't to say that there aren't people who use that beautifully. I have older clients who I do remote virtual sessions with, but that's really been an issue. Places where older people gather have been closed down. So if you were part of a church community or a group in your area, now they're not meeting. And so whether it was, I have a client who used to go out to lunch every Friday with a friend, and that was part of her socialization, she's not been able to do that. And so when you think about that's okay for maybe a couple months, we're now going on a year. That's really significantly impacting, especially older adults are more at risk for depressive issues. And so we see that a lot more.
One of the things I know is it hard for people to admit that they're having mental health issues? I mean, it's one of those, it's still a stigma out there. So how do you get people to admit or even come and talk to you?
So at Carle, I'm very lucky because most of the time, a lot of people, their first line of defense in terms of seeking help is their primary care doctor. And so because I work with their primary care doctors and I'm right in the building, we're able to get them linked with services pretty quickly. That is a much bigger challenge for at-risk members of the community. Again, people of color have a lot higher stigma sometimes, and access to services can be a barrier in terms of either affording that or getting to where they need to be.
Okay, Daniel?
How has the workload been with the abundance of new clients? How have you been able to still provide those same services for your already existing clients, but make sure you're giving the same attention to new clients as well?
So that's really been a challenge. I'm very busy, so that's an easy answer. there are a lot of different avenues and things we can do. So if a client is, let's say, relatively stable, I might triage that person. If I had seen them every week, I might say, can we go to every other week so I have more time to get somebody who's at higher need in. I'm pretty lucky that I can add on to my schedule if I need to. But we are very busy. Like, I mean, across the board, therapists are, I'm seeing patients who, like, when I first started, they had graduated from therapy and they were doing okay, and now they're having issues again because of dealing with COVID.
Are there certain warning signs that we can all be looking out for that people are experiencing some kind of mental health or a mental health stressor?
Well, you know, some of the things we've already talked about. So an increase in substance abuse or misuse, difficulties with sleeping is a very big one. A lot of times people have anxiety, they're restless at night. Change in personality, difficulty concentrating, kind of people who isolate a little bit. And so everything is kind of on a spectrum. So while you might have a little bit of that, and that might be normal for a person, if it starts to get to a point where it's impacting how they feel. A lot of times if people are off work, we know they're more depressed. Their self-esteem goes down, right? I don't have that role as a worker, and so that has changed. And so there's just a lot of different things to kind of look out for in terms of like how this is impacting people.
Someone just thinks that they have some kind of issue or they want to talk to you for the first time and they get past the stigma of calling and they set an appointment with you. Can you take us through how you deal with somebody that first time? Like what the process would be for the first time someone has to come and say, man, I may have a mental health issue?
That's a great question because I think it is really scary. You know, you're going to talk to a person that you don't know me, right? And you're going to tell me some of the most kind of sensitive information you have. And so as a therapist, my job is really to establish rapport, to let you know what to expect. We're going to talk about confidentiality. I'm going to assess sort of the severity, right? I'm going to make sure you're not suicidal or homicidal, right? And then we're going to talk about sort of where we go from here. So the first session is really collecting a lot of information. So family background, information like that, trauma history a little bit. What symptoms are you experiencing? How are they interfering with your life if they are? So things like that, substance use history. And really kind of just trying to get like kind of a sense of what is happening at this moment in time with that person.
Okay.
Because of the pandemic, have you had it to add specific services that are only exclusive because of the pandemic?
So that's a good question. So Carle has done a few things, and also some community organizations have done a few things that I think are just wonderful. So at Carle, we have something called Carle Friends, and it is trained volunteers who will just talk to you. They'll just call you or they'll Zoom with you just to chat. You can talk about hobbies. You don't have to talk about mental health. But to reduce isolation, they've sort of developed, hey, if you just had someone to talk to sometimes, you might feel a little better. There is a program at Lifelinks, which serves Coles County, but this program is free of charge for COVID people experiencing issues because of the pandemic. And so they have therapy services available as well. So we've done a few things also in terms of supporting our providers. So the people who are providing care to people who have the diagnosis or are going through treatment processes or having residual symptoms or things like that, we have a support group that meets just for them as well. Mm-hmm.
I want to go back to like what I was talking about with the appointments and things, and you're setting one of those early appointments. Maybe it's their first, second, or third meeting. Do you give them goals or life goals or challenges, or what? How do you go about so they can hopefully start to feel better about themselves as well?
So, in working with a person, I'm going to say, if you're my client, I'm going to say, Jeff, what are the things you really want to work on? And you may say, give me 3 things, okay? And then I'm going to say, all right, you prioritize those for me. What of those things would you like to address first? And then we're going to tackle those. Like I always think about, you're going to tell me, here's where you are, here's where you want to be. My job as a therapist is to get you from there to there.
That makes sense. That's cool. Daniel?
What are some of the things you do that may commonly result in progress for
Oh,
clients?
good question.
Commonly result in progress. I think one of the most interesting things about therapy for a person who's just maybe never been in therapy is it is not an intrusive, I'm not going to ask you to come into my office and tell me your deep, dark secrets the first 5 minutes that we've met, right? So it's kind of an unfolding. I think sometimes goal setting can be helpful. We do that a little bit. But a lot of times I think it's developing what does that person need. So it would be different from person to person. A lot of times it might be things like coping skills, healthy coping skills of if I'm feeling anxious, if I'm feeling depressed, what are some of the things I can do to help myself feel better? And so sometimes having some of those things. The other thing I would say is when you're in therapy, it sort of normalizes the experience, okay? So if you're depressed and you're talking to me and I can say, oh, many of my clients have the experience of having this, that, or the other thing. You're not feeling so alone then. And so it takes some of that stigma, like you were talking about, away of you're not the only person who's having anxiety. You're not the only person who's feeling depressed or scared or nervous or whatever it is. And so sometimes that can help, just kind of knowing, oh, I'm not crazy, right? Taking that away from a person can be really helpful to them.
Have you had to deal with people who are afraid to go back out into public? You know, they've been either because of their job or having COVID or whatever, they've just been quarantined or just decided to stay inside almost a year now, and now they're allowed. We're hopefully going to be allowed back out a little bit more as the months come up. But have you had to deal with that, and how you kind of get them to deal with going back out into the public lifestyle and workplace?
Yes, I mean, people are anxious about a lot of different things. It's, at first it was we didn't know what to expect. And whether you were a mask wearer or non-mask wearer, wherever you were, and if you're a vaccination person or not a vaccination person. So there's a lot of concerns and a lot of worries. And I think, again, we're kind of creatures of habit. So if I'm used to being home every day, and all of a sudden I have to get back out there and I have to do that, that can be a little anxiety provoking. And so sure, I was just talking the other day with somebody, I'm like, I'm a little nervous to travel, and I'm like, I'm not nervous to travel most of the time, but it's just because it's going to be different. And a lot of times when we don't know what something looks like, it's just anxiety provoking.
You said something about vaccination. You mentioned before the show that you've had your vaccination, so you feel comfortable about that. How do you get people who don't want to be vaccinated, but they want to go back out in public, or what is your strategy there to convince them to either get vaccinated or to be extra careful if they don't want to be?
So I would never say I would try to convince somebody one way or the other. I made the choice for myself that was right for me. When I'm working with someone, the things that I will encourage is, I think information is power. And so if you are afraid of a side effect, for example, or you don't want to get vaccinated for a certain reason, you can get information and learn if that's really accurate or not. The other thing I would say about that is, when you think about it, sometimes there was anxiety about getting COVID first. And so then people are like, oh, I can wear a mask and I can socially distance and I can wash my hands. Here's the things I can do.
Yeah.
And they felt kind of in control. And then they're like, oh, now this vaccine, from a psychological standpoint, that's somebody else did something, right? I didn't invent a vaccine. And so when we have to put our faith in somebody else, sometimes that can be really scary. And so it's just processing that. Like, what's the fear? What's going on there? Do you need information? Or what do you need in order to feel comfortable making a decision? Either way.
How has the pandemic affected counselors like yourself beyond the numbers of new cases and some of the other kind of common stuff we've already talked about? So maybe something that people might not know or people might not commonly think of.
Well, therapists are people too, right? That'll come as a shock to a lot of my clients. But, so I'm living in, a reduced contact situation. I've been working from home most of the time. So I have all of that same thing going on in my own life of I haven't seen my family. I have grandkids that I haven't seen in over a year, And so that's really hard. So yes, as I'm still doing my job, I'm also going through those same things. And so trying to balance, got to take really good care of yourself when you're a therapist, right? So that you can continue to help people. But that's, to me, the biggest challenge of, the job was stressful before. And now it's just that there's so much more need it's just a little bit more intense of an experience as a therapist.
And along those same lines, healthcare workers and nurses who are putting in God amounts of hours, and doctors as well, and everybody in the medical community, you also have to talk to those folks, I assume. And I mean, they're going through it on a daily and a weekly basis.
So, first responders have always been a population that is exposed to a lot of trauma. And again, not for sure knowing what is the experience and the impact's going to be on nurses and doctors and things like that. But, when you listen to what people in that position have to say of, I'm working so many hours and the work I'm doing is so intense, and initially people were in the hospital and they weren't allowed to have visitors, so nurses were sitting with people as they died, and doctors and other providers also, and so that's a pretty intense experience. And so knowing that there's going to be some trauma work maybe down the road because of that experience.
When you are treating your clients, as you say, is there a gauge for success that you use? Is there any kind of study, or do you just have the feeling, I think I've made headway with Daniel, I've made headway with Jeff? How's that work?
So I would say two things. One, I always measure progress as the client measures progress. So if you feel like you're doing better, and people will say that to me, gosh, I feel better this week, I've coped better, or I'm sleeping better, or they can point to something, or my relationships are less tense, or whatever. So to me, success is as the client measures it.
Okay.
There are tools we have. There are scales for anxiety and depression and trauma and things like that. And so we can use those if we want sort of, a very, kind of subjective or objective measure. But. Mm-hmm.
So we've been in a pandemic for almost a year now. Have you seen a decline in kind of the fear of COVID-19 since the start of the pandemic with your clients and until now?
I would have to say no. And I think the reason is, initially when we all went home, for example, like I did, I might have known someone who knew someone who knew someone who had COVID. And now I think almost everybody knows someone who's had COVID. And so the experience initially, I think, was kind of very far away. Somebody, right? And now it's somebody I know. And now in my practice, I am working with clients who've lost a person to COVID. And so they're grieving. There's a loss, and there's a lot that goes with that when you experience a loss. Sometimes many family members have been sick, and so then there's survivor's guilt of how come I made it, and my brother didn't, and so those kinds of experiences. And so I think we're going to get there where we're less afraid, but I think because it has really kind of hit home here in this area, I think there's still a lot of anxiety about it.
The COVID numbers are decreasing in Coles County as well as the country, even though, unfortunately, I think we reached the 500,000 death mark this over the weekend. So, do you think there's hope on the horizon, or assess where we are almost a year into this thing?
I always think there's hope. That's my job. I always think people can be better, do better. And so I do think we're going to get to a place where either because of, vaccination, or because of declining numbers, or because of different things we're doing, I think the world is going to open up more, but I think it's also going to look different, and none of us know what that's going to be like.
Speaking of that, what do you think has worked best? I mean, I know masks have been on the forefront of everything, but I mean, we're keeping better care of ourselves. You talked about keeping better care of bodies, and I think people are sanitizing their hands so much that our hands are all white and crusty these days.
Right.
So, what do you think works best, or is it a little bit of everything?
So I think a lot of it is sort of mental. Washing your hands, wearing a mask, these are all things that are important to do. But we also have to remember, kindness and understanding of other people, of whether you choose to wear a mask or you choose not to. Like, I can deal with that. I can live in a world where we can disagree and be okay. And I think a lot of times people get very highly agitated if they're on this side or that side of the thing. And so I hope that we have more of a coming together, no matter what the future looks like, that we're just all a lot kinder to one another. That would go a long way.
Any volunteer opportunities for people who may want to help ease kind of the pressure and the workload that are on you guys right now?
Well, not for me necessarily, but there are some wonderful things. So, NAMI, which is the National Alliance for Mental Illness, has programs for persons who themselves experience mental health issues and families. Carle has classes called Mental Health First Aid, and that's something you can attend, and it helps you learn how to work with a person who may be experiencing some kind of psychological crisis. And so just some education on if you can be of help in some way, what could you do and what would that look like?
Schools are starting to open up a little bit more. I know here in Mattoon and Charleston, they're going at least 4 days a week now, full time. Your thoughts on that? Do you think that'll ease your workload, increase your workload, or somewhere in between?
So I don't work a lot with children. I have some.
But the parents and stuff. I mean, they're going to have more time. Maybe, I don't know.
I hope. One of the groups we know hardest hit was women with school-age children, and so because one, they're home a lot. It was impacting career. Things like that, stress level, that was already kind of a high stress level group of folks anyway. And so I hope that is helpful. But again, it's very hard because there are parents who are still scared to send their kids back. There are parents who are like, oh, please take them back, right? Children need that socialization. They need that connectivity. And so that's also important. So yes, I think it will be very helpful overall, as long as a person believes in that, and that's the right decision for them and their child.
You talked a little bit about traveling. Sorry, Daniel. You talked a little bit about traveling, and you like to travel. But what about people who have to travel because of a job or who want to travel? Is there advice for traveling right now that you can give from your standpoint?
Well, I think, again, when you're traveling, you're away from your home base. And so being connected to partner or family or whatever your group is back home, really good self-care. Like sometimes when we go on vacation, right, we throw the diet out the window, we don't exercise, right? And so it's continuing to do the things that we know are good for us anyway, sleeping, maintaining a routine, eating healthy, moving a little bit. And for people who have to travel for work, I think that's already been sort of a challenge. But again, to me, it's just very good health care would be what I'd recommend.
Okay.
I have a more lighthearted question.
Oh, okay.
What is something that still amazes you about your profession?
What is something that amazes me? I think
Coming to talk to me and Daniel, which should have been the first answer, and then second would be next.
I think that we're always learning something new. Sometimes, like listening to music, you think like, oh, every music that's ever going to be made has been made. Like, how do people come up with something new? And in the field of therapy, we're learning things all the time. So we're learning new approaches to dealing with trauma and helping people with those kinds of issues. We learn things that work better and have new innovations, and we learn how to do things better in our profession, and that makes us all stronger, right? So. Mm-hmm.
The side of that this pandemic has made the people that are alone at home or alone in a hospital or alone in senior care. It's tough on everybody, on the family. So what advice do you give for families who can't go see their loved ones, who can't see grandma because she's in a daycare or a care facility that doesn't allow visitors?
Mm-hmm. So that's a very hard situation, and I've had many clients, unfortunately, have that experience.
Yeah, everybody seems to right now.
A lot of nursing facilities are very good about, hey, even if mom doesn't know how to Zoom, they'll bring a camera, or they'll bring a laptop in. On the phone, they'll let you talk through the window. Sometimes there'll be a designated place. And again, it's trying to, doing what you can, but then also that sense of loss and that sense of fear, whether it's working with a therapist or talking to a good friend about, this is really hard. Like, I'm really scared for my mom or my dad or whoever it is, right? And so being able to move through that experience so that they're not just carrying that around by themselves.
Okay.
So say a person is experiencing these kind of early kind of warning signs that we talked about earlier, and they don't feel like they need to go get help right away. Are there any things that they can do individually to kind of assess whether they need to go get help or whether if it's just something small that they can get over really quickly?
So I think it would depend on how severe it is. Like, to me, the first thing is just talk about it. right? Like, one of the things that we say to people, if you're worried if someone is suicidal or thinking about hurting themselves, is ask the question. Like, say, you know, are you thinking about killing yourself? Like, don't mince words. That's not going to plant that idea in a person's head, but it's going to give them the opportunity to talk about what they're experiencing so that you can help them, right? Because now I know, okay, that's what that is or is not what's on your mind, and now I know what to do next. If a person is not functioning the way they used to function, they start failing classes, for example, or, you know, something really changes. If they start to have a concrete plan of, I'm really going to do something, that is definitely time to seek help immediately.
You said you had some up-to-date stats. Is there anything on your paper and your notes that you would like to get that information out today? We have a couple minutes left.
So one of the things that just really, really struck me is, so this comes from the Centers for Disease Control and Prevention, and so they did a survey, and this is in July of 2020, and so this is only from January through June, which is a little scary. And so people went from adults reporting symptoms of anxiety and depression was about at 11% of the population, and it's now, and at this survey in July of last year, is at 42%. So that is just a significant increase in terms of what people are experiencing in their everyday lives.
And when you think about that, I mean, that's almost, that's fourfold, but really everybody has some level of anxiety with this thing, you know, at some level. So it's amazing. A couple minutes left. Anything else before we go rapid fire questions?
No.
I know you love these, Daniel. All right, we'll have a little fun last couple minutes.
Wait a minute, does Dane have to answer these too?
Yes, he does.
Oh,
Yeah.
okay, all right.
we
We're
make- we
both
make
on the
it.
hot seat,
Yeah,
Dan.
that's the
All
problem with
right.
being
All
a
right.
student.
All right.
Favorite medical-based TV show or movie?
A Brilliant Mind.
I don't have one. I haven't, like, I'm not a fan of, like,
It's all
those.
right, there's no wrong
I like
answer.
Law and Order.
There you go. Well, that's
Okay.
close. One fact about your hometown. I don't even know where you're from. Where are you from?
I'm from East Moline, Illinois.
All right. One fact that we don't know about East Moline.
It had, when I was growing up there, it had the highest percentage of Belgian immigrants in the United States.
I'm from Waukegan, and Ray Bradbury, who wrote Fahrenheit 451, is from my hometown.
That's awesome.
St. Patty's Day is the next quote-unquote holiday coming up. Do you have any traditions or dinner or something you have to do on St. Patty's Day?
Oh, corned beef and potatoes for us.
Same.
Very good. All right. Your favorite singer?
Oh my gosh, that's such a loaded question.
There's only a million of them.
Singer, like one.
Or an artist. It could be an artist.
Okay, I love Godsmack. Happens to be my band de jour right now.
That's
and
all right.
so Sully Erna from Godsmack.
Beyonce.
Yeah, Beyonce. Yeah. Your first car, what color was it?
Oh my gosh, my first car was a 1970 Volvo station wagon that was white, and we called her Moby Dick.
My first car was clear because I haven't had a first car yet.
Oh, yeah. All right. Do you have a pet?
I do not.
No.
No pet. All right. Do you like to fly? You said you like travel, but do you like to be in airplanes?
I don't mind it.
All right. Did you see the video this past weekend?
Yes.
All right. Sure. Go
I
ahead.
actually want to be a flight attendant if my journalism career doesn't work out.
There you go.
So,
Well, we thank you, Krista Taylor, for coming in today. She's from Carle, licensed clinical professional counselor. If you need any help, you can contact her or any of the folks out at Carle. We appreciate their support. So thank you so much for coming in.
Thank you.
Daniel, as always, great job today. And we are WEIU. Everybody have a great day.